Hi everyone, I am Dr. Krishna Reddy, consultant endocrinologist, Medicor Hospitals, Madhapur. So, what are the various complications of diabetes, long-term complications? So, diabetes is a disease which causing the hyperglycemia, so excessive glucose in the blood, so that will cause organ damages. So, this high glucose will cause a lot of oxidation generation, oxidation free radical generation, and advanced glycogen end products generation, so which will damage the various epithelium as well as the vasculature of the various body organs. So if you see, they are broadly classified into microvasculature related complication and macrovascular related complications. So microvasculature related complication, they generally seen in the form of retinopathy, that is damage of your retina of the eye, so which will lead to the bleeding and new vessel formation, and which will ultimately slowly lead to the decreased vision and vision loss. And the other microvascular complication is nephropathy. So there is a damage in the microvasculature in the kidneys, so which will lead to protein loss as well as increase in creatinine levels. And the other microvasculature related complication is the neuropathy. So this neuropathy will lead to the various symptoms like, so other microvasculature complication is the neuropathy. So this neuropathy will lead to a lot of symptoms like burning feet and unable to sleep at the night. So this will also lead to decreased quality of life. And macrovascular complications, so these are the major causes of death, especially your myocardial infarction, that is the heart attacks are more common in type 2 diabetics. We see almost 25% more, almost type 2 diabetics will have a macrovascular this myocardial infarction as a complication. And other macrovascular complications is cerebrovascular accidents, that is the brain stroke. And other macrovascular complications are like peripheral vascular disease, that is a diabetic foot, that is a decreased blood supply to the foot. Along with the neuropathy and vascular issues, they may cause foot ulcers and problems in the foot. And other complications like erectile dysfunction is also seen in especially men, which can cause erectile dysfunction and other sexual problems. And apart from these major and complications, we also see minor complications like poor memory and poor concentration and Alzheimer's like symptoms, and easily forgetting the things. So these are also seen, and hearing loss also seen, and various infections also very common in diabetic patients, especially that genital infections and cutaneous fungal infections and other infections are common. So these are the long-term complications. How to avoid them? So take care of your proper sugar control is the mainstay to avoid these complications. So if you are able to control your sugars to as normal as possible, the damage related to the glucose will be minimal, and long-term complications will be minimized. Apart from the glucose control, you should follow a healthy lifestyle. So you should check your weight regularly, and you should control your weight, and your blood pressure should also be in control, and your cholesterol should also be in control to have a lesser impact of this diabetes on your body. So apart from this, the healthy lifestyle is always helpful. The more you do exercise and more you control your weight, so this is also beneficial in preventing the long-term complications of the diabetes.